But just the pervasiveness of human suffering in this beautiful city of Seattle, in terms of people experiencing homelessness, just stood out to me.
I'm very excited. I'm here this afternoon with Jonathan Kumar. He's the founder of an outfit called Samaritan. And Samaritan has always been a fascinating company to me, and especially with what we're trying to do and to advocate at Urban Entrepreneurship Initiative, because Samaritan is a for-profit company that is addressing the issue of reconnecting unhoused people, homeless people, with housing, with services, and with the community. And so to me, it's a prime example of what I call the Holy Grail, a company that seeks to do well by doing good.
Mm.
So, Jonathan, thank you so much for doing this interview. Good to see you again.
Yeah, thanks, Professor Tarver, David. It's good to be here, and glad to share our story to see if we can get more people, focused on impactful entrepreneurship.
Yeah, yeah. Well, I want to get into the business and so forth. But from what I know about you, a lot of what influenced the business is, your experiences in life and your upbringing. So I just wanted you to take a few minutes and tell me, your background story, your upbringing.
Of course, yeah, yeah. So my parents are from India, South India, and my dad got a chance to study in New York in the late '80s. So he met my mom. They came over, and I was born, yeah, in Buffalo in
Mm,
1989. It was a time where my dad was in school, my mom wasn't working, so we were living, the three of us, on a single student stipend of about $600 to $800 a month, which went further then than it does now, but still, very much on the fringe. I was born in a public hospital, lived in public housing, food stamps. Our car was worth about $1,000.
mm,
Um, and very quickly we came to realize just how important, um, like, community investment into us was. There was a nonprofit, just a local church, basically, that essentially had a heart for immigrants or people new to the country, and sort of adopted us and
mm,
provided, over for 5 years, financially, provided relationally, even legal support for us, such that when my dad graduated, we were able to stay in the country, actually. Um,
mm.
just because of this support that was received. And so, that feeling never goes away, that investment that we received. And fast forward 25 years, I got to study at the University of Michigan. I got to do a lot of things at Michigan, from film to user experience design to psychology and statistics, computer science. My degree was in informatics out of the School of Information, and then economics. But yeah, graduated, did a startup coming out of Michigan. They have amazing startup programs like Startup
Yeah.
Weekend, Center for Entrepreneurship, so forth. Did a startup, ended up expanding out to Grand Rapids, Michigan, and then to Seattle in 2015. And in 2015, I felt like maybe I was being called to something that had greater potential for impact than the work I was doing at the moment.
Hmm.
And, I thought maybe I would take a year or two off, work at an ad agency or a tech company for a while before I figured out my next move. But just the pervasiveness of human suffering in this beautiful city of Seattle, in terms of people experiencing homelessness, just stood out to me.
Yeah.
And
Well, let me
yeah,
let
go
me
ahead.
take a minute though, because
Yeah, yeah, yeah,
you
yeah.
you stepped through some things, and I just want to make sure that we get the essentials down pat. So I want to go back to Buffalo for a minute, because
Yes.
your folks were in Buffalo. You went your early grades in Buffalo. Did you stay in Buffalo the whole time, like through high school?
No, honestly, it was just 5 years, the first
Okay.
5 years.
Okay.
And and so we weren't there long, but it the reason that we got to move to the Midwest, I spent time in Madison and then Chicago area before Michigan, was largely because of the type of support that we received in
Okay.
Buffalo.
And where were you when you graduated from high school?
It's like outside of Chicago, like 13 miles, something like that in the suburbs.
Were you in those northern suburbs like Skokie, Winnetka,
Straight
Highland
west,
Park?
near Oak Park,
Okay.
Naperville. It's
Neighbor. Okay.
a place called Elmhurst.
Okay. Yeah. So I worked at Bell Labs for a number of years. And
Mm.
Naperville was a huge Bell Labs facility there. I never visited there, but I knew a lot of people from there. So yeah, so
Mm.
you graduated from high school, you were in Illinois,
Hmm.
and then you had the opportunity to come to Michigan as an out-of-state student.
Yes, yes. And, my dad had a successful career kind of starting when he got his first job in the Midwest
Yeah.
after school.
Yeah.
And that enabled me to have an opportunity to study, yeah, at Michigan, out of state, huge privilege.
Yeah.
I got in, among other schools, and he had gotten enough good work recommendations where he was like, yeah, it's more expensive, but I think it could be
Yeah.
worth it. And I'm really thankful
Yeah.
for him and my family to support me to be able to come to Michigan for 4 years.
Yeah. So during your undergraduate years at Michigan, as you say, you were in informatics and user interface design, and was it econ? Was the other?
Hmm. Hmm.
And so how did you get connected with entrepreneurship in that space, or what incited that interest?
Yeah, I think there was a bug in there from the beginning, before I was like part of any formal curriculum. I was stuck on North Campus as a freshman, which is engineering, and I wasn't necessarily going to be an engineer. And I was in this kind of weird building that didn't necessarily have like a strong sense of community, and I just felt like there was something missing in terms of helping students meet through playing sports together. And so my freshman year, I started this community for North Campus called the Northside Ballers, which is actually how I met your son. I can't remember if he was
Yeah,
in he was in
yeah,
Bursley, maybe.
yeah. He was
Um,
in but the Smith houses out there, I think. Yeah.
Yeah, yeah. And so we started like a sports group for people that wanted to network or meet other students through sports. We played
Mm,
a lot of tackle football, no pads. Actually got some sponsorship from the team,
okay.
um, and then other sports as well. And so that was like my freshman year, and then we started. A couple friends of mine and I started like the TED events at the University of
Mm,
Michigan. So,
mm.
brought in like people from all over the country or world to come in and share at Michigan these like
Oh, okay.
inspiring talks. And
So you started the TEDx at
mm-hmm,
Michigan?
yeah,
I
yeah,
see.
one of the leaders, not the
Yeah.
guy.
Yeah.
And then it was funny, like that was my junior year, and I got David to April or like mid-April that year, and I hadn't secured an internship. And so like I, you know, I was sweating bullets. I was like, okay, I'm gonna be stuck making copies or coffee for someone in Detroit or something all summer. I'm not gonna have anything meaningful to do my junior year because I've just been focused on this TED conference. And so two of the organizers, kind of in the same boat as me, were like, well, why don't we just like make up our own internship and we will ask the TED network what are the coolest things happening in, Kenya or India or Honduras or something. And then we'll
Mm,
go and just learn from these organizations.
mm,
And we turned that into an internship, quote unquote, in India that turned into a documentary film that's on Amazon.
mm.
On YouTube.
Is that the
So
Talim?
that's right. That's
Yeah.
right. Yeah, yeah.
Mm,
And that was all about social change as well. And so yeah, I think all of these random things. I got to be a part of different leadership trainings with my church and stuff. So by the time my senior year came around, I started doing some coursework at Center for Entrepreneurship, I had some background, and the startup weekend of 2010, I want to say, it's a long time ago now.
Yeah.
2011 was a huge turning point for me in terms of actually focusing on building things versus just joining a company.
Mm. Yeah. What courses did you take with CFE? Do you remember?
Uh, I don't remember too many of them, honestly. It's been a while. I know Doug Neal was teaching one, and Amy
Oh yeah.
Klinke, and then of course Moses Lee.
Oh
He
yeah.
he and this guy Nick
Tobier. Yeah, Nick
Tobier.
Tobier. Yeah.
They were leading this course on social venture creation, which is so funny because at the time, like the topic really didn't interest me that much. I wasn't so attached to this idea of social entrepreneurship. It kind of sounded bizarre to me, but I took the course. That was one of them, and obviously, many years later, really fell into social entrepreneurship versus traditional entrepreneurship. But that was one of them. But yeah, the kind of the path into social entrepreneurship was an interesting one. Like the idea that I pitched at the startup weekend in 2011 was called food circles. And
Mm.
the original concept for it was essentially eBay for restaurants, where
Mm.
restaurants could bid on groups of friends or family that had signaled an intent to dine out, but
Mm-hmm.
hadn't decided where to go yet. So
Mm.
you would signal your intent, and restaurants with open capacity seeking new customers would bid on your table, different
Okay.
discounts or VIP treatments or meet the chef type things. And
Mm.
I moved out to Grand Rapids. We because we got into an accelerator out there, and man, the first 10 weeks of me being in Grand Rapids that summer of 2011, we had no revenue. We had zero restaurants like buying into what we were doing. And I was, we were about out of cash, we were about out of enthusiasm, about to pack it up. Um, but I remembered some words that a mentor in on campus, sort of my campus pastor, had given me when I was noodling this idea and pitching it at this weekend, because it was successful. We got some like early people helping us work on idea and stuff. And he was like, I wonder what you could do to solve needs and not wants. You know,
Mm.
to feed
Mm.
to feed people that need food versus just
Yeah.
want food.
Yeah.
Because at the end of the day, the eBay for restaurants thing was just getting people like me discounts on my chicken
Yeah.
wings or
Yeah.
my chips and
Yeah.
salsa, my burritos or whatever. Like
Yeah.
was I really truly solving something that mattered? And we made sort of a last second 11th hour pivot, before we ran out of money at Food Circles, to focus on this buy one, feed one concept,
Mm.
where restaurants could select a dish that they wanted to move more of, wanted feedback on, and they would put that on our platform. And then you, as a consumer, could pay whatever you wanted for that dish, and 100% of the proceeds for that specific dish would go to fund a local food bank and
I
put
see.
meals on the table for families who couldn't afford to eat at that restaurant.
Yeah.
And that, not only was that more meaningful, it sold a lot better
Mm.
to restaurants. We got 10 restaurants to agree to $50 a month for this service, and that we were kind of off and running,
Yeah.
at least with that business. And so it was like I didn't really like aspire to be a social entrepreneur. it
Yeah.
it actually made more commercial business sense for us to
Mm.
do something that had more meaning than
Mm.
the original concept.
Yeah. So you started that that effort led you to Grand Rapids, and you were doing this work in Grand Rapids. And so what became of that, and how did you
Mm-hmm.
then end up in Seattle, or make the transition to Seattle?
Yeah, it's a good question. So we raised a little bit of capital from different angel investors and so forth, and we felt like we were doing something good. We had about 20-25 restaurant accounts, and they were paying us, say, about $100 a month, and we're like, Grand Rapids is a little big city, so we're like,
Yeah.
okay, let's get after our second market. And so we, long story short, we were looking at Madison, we were looking at Chicago, San Francisco, and Seattle. And Seattle sort of fell in between Madison and then like Chicago, San Francisco in terms of like competition, cost of living, restaurant scene. So we picked Seattle, and then we went to our investors and said, "Hey, give us money to launch this second market, a bigger market." And they
Mhm.
were like, "Well, you got to go prove that it works in another market before we'll give you any more money."
Hmm.
And so we were like, "Well, we kind of need the money to prove that this works in another market." And
Chicken and egg.
they were just like, "Sorry, tough. Go make the best of it." And so I did pack my bags, moved to Seattle in 2015, and we actually got some restaurants hooked in, but we didn't have any users. We didn't have any diners,
Hmm.
and we did a launch. It was more or less a failure, where we had restaurants but no consumers. Were a part of food circles, and then I think that was when I was like, is this what I am ready to sink another 10 years of my life
Yeah.
into?
Yeah. Yeah.
And
So the
yeah.
business model in that case, for food circles was the restaurants are looking to engage more people, get them excited about new dishes, that kind
Mm-hmm.
of thing, and they're willing to pay you to bring these people to the table, in effect. And
Yeah.
the users, the regular people out there, want some different new dining experience, want to feel like they're part of something new. They're not paying anything. They're paying for the meal,
Mm-hmm.
but they're not necessarily looking to provide any money to somebody that needs a meal. They just want to be part of that circle.
Yeah,
Was
that's
that
right. Well, good puns there, David. But yeah, and then the restaurant was not only willing to pay, 50 or 100 or $150 a month to us for the service, but they were donating the proceeds from that dish to a food bank in their
Yeah,
neighborhood or in their city.
yeah,
So it was like a win-win-win-win-win. It just ended up being, the cost to acquire the restaurants and the cost to acquire the diners was, just too high
mhm,
relative to, the revenue we were generating. The
yeah,
unit economics didn't end up making sense.
yeah,
And so, we put the effort on pause, which was tough to do because, it was generating, you know, $2,000, $3,000 a month,
yeah,
and
yeah,
that was what I was living off of. So to
yeah.
put that
So
on
it was,
pause was
how
tough.
you say we, was it you? How many other people were involved in this with you?
Mm, it's a handful. It was a handful of people, contributors, part time, full time,
Okay.
co-founder. Yeah.
You were the main person in that
That's
thing.
right.
So even with just one person, 2 or 3 grand a month is not going to sustain you, a life, right?
Yeah. Well, at the time it did. I mean, I was living off of $1,000 a month, and it wasn't that bad.
Oh wow.
It was a start. I was
Yeah.
24, 25.
Okay. Yeah.
And uh my dad covered my cell phone bill,
Yeah.
and
Yeah.
took public transportation. I was on food stamps myself again for a little bit,
Yeah.
but
Yeah.
it wasn't too bad. It wasn't too bad. It was
So
more
you're in.
like, I have limited amount of time and I want to build things that people really, 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 really want
Yeah.
and need.
Yeah.
So,
So
yeah.
at that point, you're out a few years out of Michigan. You had started this thing, you tried it, you had some experience with it. You could at that point say, yeah, this was nice. Let me go get a corporate job. You got all these
Hmm.
corporations in Seattle area and whatnot, but
Hmm.
you elected to do something else. So tell me about that pivot and that decision.
Yeah, that's good questions, and I appreciate you zooming in. Because yeah, I thought of food circles as essentially my form of grad school. I'd spent
Yeah,
about 3, 4 years on this venture, and had learned a ton. I had a lot of successes, had a lot of failures, and I felt like I was coming out with like, okay, now I know how to build something, what not to build, how to recruit, how to sell,
yeah,
some basics around fundraising and finance. And so, I was like, okay, I'm a couple of years out of school, essentially my grad school. Maybe I'll take a couple of years now to work, get some more corporate experience and then go back to the entrepreneurship thing. And again, that's when I just felt, you know, called, given what I was seeing in the city. Um, I identified this very unique population, this unique user that didn't have a home, that was, literally begging strangers for help on the
Mm.
sidewalk. And
Yeah.
and I felt like, a lot of times when you walk by someone on the street, you either don't have time to engage, you don't have cash on you, or if you have cash, you're not sure if giving that
Yeah.
cash to that person is going to make a positive difference or not.
Yeah.
And so, with all of those questions in your head, the easiest thing to do is to do nothing and to just walk
Keep
by.
walking. Yeah.
And it's tough. And it's just like, I have some money. Like, if the person had just held out a credit card reader or terminal or something, and I could swipe and know that, that $10 or that $5 or $20 was actually going to help this person, I would be happy to swipe and keep going.
Yeah.
And so I was like, I bet, if I have this problem, every commuter in a major city has kind of this challenge. And there are so many people on the street that aren't able to communicate their true needs and access the resources they need to reach their goals and for that they have for their own life. So, I would love to develop, to solve for those two things, like make it easy to give, make it easy to receive, and make it
Yeah.
strategic to give, where you could give and know that those dollars would actually help someone move forward.
Yeah.
And so, because I felt like I had some capability coming out of the food circles experience, I felt like I had some culpability, given how big the problem was.
Mm.
So I just started researching that as I was kind of putting Samaritan on ice. I was like starting to do a lot of user interviews around this new way to help people access the capital, financial and relational, that they would need to, find a stable home.
Hmm. So how did you shape this? Did you actually what did customer discovery look like, in that kind of situation?
Yeah, yeah. Well, that's the thing, is that I didn't know who the customer was going to be. I knew who the user was, who my target user was, but I knew that they were not going to ultimately pay my bills.
Well,
I was not.
that's what I meant. I meant even
Hmm.
the users,
Yeah.
the
Well,
user discovery.
user discovery was easy. They were all over the place, and I would just walk up to people sometimes with a couple bucks or a water bottle or a granola bar, and
Mm.
just ask them their story and ask them,
Yeah.
do you mind if I ask how you got here? And
Mm.
do you mind if I ask where you're trying to go? What you feel you need to get to where you're trying to go. What's holding you back?
Mm.
I just asked these questions, and most people were, willing or happy to talk to me, talk to somebody,
Yeah.
really.
Yeah.
So that part
What
was easy. And
what
go ahead.
general sense did you get from that? I'm sure there were a lot of people to talk to. You probably talked to a lot of people. What was your general takeaway from those discussions?
Yeah, I mean, that I, probably had 50 to 100 conversations that summer, and have had over 1,000 probably in total, in the years since. Um, there was a lot of, systemic, there's oppression and racism at play, first off,
Mm.
that keeps people from being able to communicate their true needs, their true identity to people that are able to help. There was, a guy in particular, one of my first conversations, who, was holding a sign that said, need medication for the diabetes in my feet. And I watched him at a distance for about 20 minutes as not a single person responded to him, not a single car window opened to him
Mm.
passing by. And he I went up to him and I asked him, like, what do you feel your challenges are in terms of raising this money? And he just said, I've got the wrong look for this, the wrong skin color. Nobody believes me.
Mm.
Nobody believes that I actually need medication for
Mm.
my feet. And then, my heart sort of broke there. And then my next question was, well, you shouldn't have to pay for this medication if you don't have any money. Do you have access to a doctor who could give this to you for free? And he said, yes, I do have a doctor. I'm on Medicaid, and doctor through this shelter I'm staying at right now, but he only gives me about a fifth of what I need to manage the pain on a monthly
Mm,
basis. He thinks if he gives me more, then I'm gonna get addicted to it or sell it.
mm,
It's just like, man, this is beyond sort of the financial poverty this person was facing. This sort of total sense of relational poverty from professionals, from everyday people passing by, from a lack of friends or family that believed in him.
yeah.
It was tough. So, I think that is like one of the reasons people become homeless is because of a lack of social capital or relational capital. Either they never had any to begin with, or they burned the bridges that they had, and when the medical event happens, or the job loss happens, or the abuse happens, or the significant financial event happens, that's why people end up homeless, is because they don't have a couch, someone's
Hmm.
couch to crash on.
Mm,
So that was like something that stood out to me from those interviews, was like there's a lot of like kind of like instigators, but the reason people actually lose their housing is a lack of relationships.
hmm.
Um, and then in terms of like the path out, like most, I would say over 50% of the folks that you meet, like they have goals to be housed, to be close to their kids or their grandkids, to be working
Mm,
again, independent, to give back.
mm,
Um, but it's just so hard to make progress through the social safety net when you're not sleeping well, when you're sick, or your belongings have been stolen, your phone's been
mm.
stolen, you feel dirty, or you are dirty, you have no place to store your belongings, like all of these things, or you're treated as like, unworthy, or you feel invisible, you have promises broken, or all of these different things, and that makes progress, through the action steps that you're supposed to be taking, and get your ID, to submit a job application, to show up for the interview, to crush the interview, to get the call back, to start working, or to apply for housing, to do the tours, to go to the recovery group, or go to the clinic, like all of these things that you're supposed to do when you don't have bus fare, you're just, you haven't slept in 14 days, like it's
Yeah.
so hard. And so
Yeah.
that's the other thing, is like it's a vicious cycle. It's something that's really hard to escape once you're in it. And
Yeah.
if we can make it easier, um, more people will get out.
Well, you've painted a really, I think you've brought us to a point. Now I feel like, I'm almost feel like I'm on this journey with you. Now we're down in the trough, right? And that's what
Mhm.
gets to the fascinating part of what you're doing, because you wouldn't think that something like this, you could turn addressing a situation like this into a profit-making business, right? And a lot of people would feel like, that it's even bad to think about that. But if you're going to solve this problem in a sustainable way and address more and more people, that's a strategy for doing it. So after all that discovery, after seeing this situation, I remember being fascinated by your initial approach to this thing, the technological approach and whatnot. But
Right.
tell me how that started. Tell me about that.
Yeah. Well, it certainly didn't, if I wanted to generate a lot of money, I wouldn't have been focused on this to start, the idea of generating profit, and, becoming a millionaire or anything like that. We haven't generated a profit, and we've been at it for 8, 9 years now. We're getting there though.
Yeah.
But I think, when I was grappling with the idea of like for profit versus nonprofit, um, I knew my primary orientation was to do two things: to deeply impact people without a home, and to do it at scale. And so to do things at scale, that's where technology can help. And um I wanted to reach hundreds of thousands of lives with
Yeah.
um that would, by solving two things, like making it easier for people to access capital or to give capital, and
Yeah.
making the system, making it more strategic, and aligning the capital with action steps, with material progress to improve a person's situation.
Yeah.
And I felt like I could develop technology around that. And so I was like, okay, I want this to be something that's scalable, something that's technology based, that's not trying to replicate what social services is already doing, but to enhance and to aid and abet and to bolster, to create efficiency and effectiveness for what case managers are out there trying to do. Social
Yeah.
workers, community health workers, housing navigators, job navigators. And so, when it comes to building technology, one thing I would love to see is, more nonprofit or philanthropic funding being available to seed entrepreneurs that have, impact driven ideas.
Yeah.
Um, and there's not a lot out there. And in terms of fundraising, I had more experience doing it as like a startup, a for profit, than as a nonprofit. The other piece is that nonprofit funding typically flows towards like direct services or advocacy, like programs. Um, so I could fundraise to hire a case manager, but maybe not an iPhone developer,
Hmm.
or a marketing officer,
Yeah. Yeah.
and for something that wasn't directly going to feed people or house people or employ people. We were
Yeah.
creating this technology layer to give people access to different financial and social support.
Yeah.
So that was sort of the idea, and none of it actually mattered. It was just like, my orientation was to prove value for our user and create something with whatever time and resources I had that would create value for my neighbors on the street. And if I could do that successfully enough, then I would figure out who's going to pay for it, who's going to
Mhm.
fund it. And whether it be the city or foundations or some other stakeholder that I didn't know about, my orientation. And I don't know if this is necessarily the right way to do it. And I probably might have focused a little bit more on who the paying customer was going to be when getting started. But that was the orientation, was like, create significant value for the user, for individuals or families on the street, and
Yeah.
then figure out the funding mechanism, whether for profit, nonprofit, um, later on.
Hmm.
And if I can find a way to serve customers, David, versus
Hmm.
donors,
Yeah.
customers have a repeatable problem that can potentially grow and scale. If you can solve a problem for a customer, and I'm talking about separately than our user. I knew we could solve a problem for a user, but I was like, if
Yeah.
I get far enough where I can solve a problem for our customer, for a
Hmm.
customer, where they're losing time, or they're losing money, or they need to make money, or they need to look better, some sort of intrinsic motivation other than just like, oh, I want to give to this
Yeah.
cause.
Yeah. Yeah. Yeah.
Those types of tendencies around philanthropy shift and change so dramatically from year to year to year. And if I can avoid having to pass the hat for donations, I will. And I
Mhm.
actually do pass the hat some for our members,
Yeah.
to access more capital. But in terms of like our growth, if I can find a customer um, that solves a problem of their own by using our technology to help this population,
Yeah.
we have I can help more people as a corporation than as a nonprofit passing the hat.
Hmm. So you were in Seattle, going back to how this started. You were in Seattle after after
Mm-hmm. Food circles, yeah.
yeah, food circle days, and at some point you saw this need and this opportunity to address this need. And so how did you actually start with that? And how did you, it takes resources, it takes time, it takes energy, it takes money, maybe even other people to start something like this. How did you do that?
Yeah, man, that's a good question. It's bringing me back. Um, uh, let's see. I mean, there was two things this summer of 2015 that happened that, I think were big catalyst to me starting to do the research. One of them was actually a pitch competition at Michigan. There was this like Shark Tank event thing that I was invited to present food circles to. And, we were going to have like a 2-3 minute pitch, and there were some investors there. Moses might have been there. I can't remember. And I was on this flight from Seattle to Detroit, and I was kind of formulating my pitch for the prior startup. And I just felt like, on the flight that Food Circles was not going to be the best of the 10 companies presenting. I just had that feeling. I don't know if it came from God or what, but and I'm very confident. I was all in, and I was for years. So I don't know where it came from, but I was like on this flight looking out the window. I was like, man, if I don't think this thing is going to win this prize money or these investors, like why are investors going to think that it's the best? And if I don't think that it's going to win, I have no business pitching it. I should just pitch something else.
Yeah.
And so, I was a couple months into Seattle, and I was like, let me just rewrite the pitch and pitch something that doesn't exist, that, it's completely different. And ended up with some friends still on campus writing out the entire pitch on cardboard signs for Samaritan. And then the pitch was completely silent. We just went through these cardboard signs, kind of illustrating this opportunity to, create something that could make giving easier and more strategic.
Yeah.
And drive accelerated outcomes for our neighbors on the street that were trying to get off the street.
Yeah.
And I don't think we won best business because it wasn't a business. It didn't exist at the time, but we did win best pitch. So we got some money, I think. And then I got back to Seattle, and then there was a startup weekend in Seattle like a week or two later, and I pitched it there, kind of with some confidence or some enthusiasm. And I was able to kind of attract some people to the idea, including a technical co-founder who was just at the weekend. So he kind of came on and helped me prototype, and we won a couple $1,000s there. In the form of iPads. They gave iPads to every person who participated on the team because they really liked our idea. We sold the iPads and used the money to like start the business and stuff. And then it was a lot of research from there.
Yeah. And so what was the initial shot at the business model?
The initial shot was, if we could generate transactions, we can monetize them. We're like, if we can get 20,000 people in Seattle to give $5 or $10 a month, we'll generate, a $250,000, I think, a year in revenue, something like that. And so like the product was, we went to nonprofits, said we want to go on outreach with you and interview people on the street who need help. And we're going to give them this Bluetooth necklace. And this Bluetooth necklace will emit a signal 30 yards in every direction, such that if someone passes within 30 yards of them and has the Samaritan app on their phone, the app that we've built, Android, iPhone app, the passerby, the commuter, will get a push notification on their phone that just says, hey, this is Marcus, or this is Melissa. Melissa's been on the streets for 6 months now. Do you want to give her $1, give her $2, or open the app to learn more? And so we did that. We gave out like 50 of these beacons. We signed up 500 users in Seattle, which were efforts in their own. And then when they would pass by each other, we would generate these push notifications, which led to transactions, and then we would take like 10% of the transaction.
Yeah.
That business model, I don't think we dramatically underestimated how costly or how much time it would take to get 20,000 or even 2,000 Seattle residents to give $5 a month. And so pretty quickly we're like, okay, like, we are not going to survive or generate even close to as much revenue as we would need from monetizing transactions. We need to just drop that piece And when someone gives $10, allow $10 to go to the person. Don't take a cut of that. And if the thing works, like if this relational and financial generosity drives outcomes for the recipients, the Samaritan members,
Yeah.
then we will find someone to sell those outcomes to, whether a
Mm.
foundation, whether a downtown real estate group, whether the city of Seattle, county, King County, will figure out some entity to pay us for this because it's a massive problem and everyone's talking about it. Everyone's trying to reduce it. If we can figure out something that actually helps people like get off the street quicker, we can figure out the funding. Let's just prove
Mhm.
that it works, and then we'll go from there.
Mhm. The people would be donating through the app to those
Mm-hmm.
people who are on the street, and
Right.
that obviously benefit, and it allows people to the customers, in this case, the people who are providing money, they feel good that they're doing something for the community and whatnot. These organizations that you went to, what was their incentive, and what was their benefit to get involved and to help finance the whole thing?
Yeah, it's a good question. They weren't paying us, but they were involved, in terms of letting us tap into like their outreach and case management efforts and stuff. And for a long time, those partners, again, even though we weren't asking them for money, like they didn't have an incentive. It was like extra work, extra complication. Um, but I'll share the story of our first life changing outcome that we saw. Um, this guy named Charles who actually like was wasn't accessing services, had been pretty resistant to social services to this point, had spent about 3 years outdoors, was in a wheelchair. He gets one of our beacons and he starts to like receive this support from everyday people who care about him and his story. And he's using the money. We partnered with these different grocery stores and different merchants so he could like bring the beacon in and use the dollars towards whatever he needed. So he was just getting like chips, coffee, soda, clothing. It wasn't groundbreaking, but what happened was the beacon had a battery in it and it died about every couple of weeks.
Mm.
And so he had an incentive to go into a nonprofit, have a conversation, and get a new battery for his,
Mm.
his beacon to continue working. And those encounters with the nonprofit led eventually over 6 months or so. Like it was like we gave him his beacon in September. In February, I was out and about and I didn't see him on the corner he was usually at. And I saw like an outreach worker, hey, have you seen Chuck? Have you seen Charles? And they're like, you didn't hear? He got housed. And I was
Mm.
like, what? Like, that's amazing. That's incredible news. And I like kind of investigated how it all happened. And it was because after about 6 months of checking into this organization and like, you know, getting this beacon battery, he developed enough of a relationship with the case manager that the case manager eventually said like, hey, I've got a housing unit that's come open. It's handicap accessible. Would you like to check it out? We can help you apply for your voucher. And he was like, okay. And it was just like that relationship of trust led to this amazing outcome. And that relationship was built because this person was like checking in on a more consistent basis, was
Yeah.
willing to say yes to services. And so we were able to see that happen dozens of times in Seattle and show to these nonprofits like, hey, when people have access to this financial and social support from us, they're more likely to say yes to opportunities, to say yes to care, to invest in themselves because they're being invested in.
Yeah.
And when you as a nonprofit get to see quicker outcomes like that, that's time you get back to give to other people in need to
Yeah.
drive more outcomes on an annual basis and raise more money from your
Yeah.
donors or your city contracts.
Yeah. Yeah. So at this point, though, you've shuttered the idea of taking a proportion of the fees
Hmm.
that people get. As
Right.
you say, the organizations are not paying you, so you're doing good stuff for the users, you're doing good stuff for the organizations, helping them to engage with these people they're supposed to be serving. But how are you eating at that point?
Yeah, I don't remember, man. We well, I think yeah, I mean, I at this point had gotten maybe like uh 20 or $25,000 put together, and maybe 30, and that actually lasted us like 12 months,
Hmm.
and us being like me and my co-founder.
That was from
um
investors or
Yeah, angel
yeah,
investors like
yeah,
5K, 10K,
yeah,
10K,
yeah,
family, friends, people that I was introduced to. Because like I think a lot of people were like, wow, this guy is like trying to do something to solve a
yeah,
very, very difficult problem. I
yeah.
wanna I wanna support him or see if he can do it. Um and uh and our first big break came from when we were signing up Samaritans, people on the app.
Yeah.
We spoke at a church about it, and one of the people who became a Samaritan who downloaded the app said, "Hey, I work for this downtown real estate group that has really been trying to figure out this problem. Um, Maybe you could pitch it to us and we'll fund it." And
Hmm.
so they actually were our first customer. And it was Paul Allen's like downtown realty uh,
Hmm.
from Microsoft. And
Yeah.
they gave us seed capital for 2 years to test Samaritan out in Seattle.
Hmm.
So at a time where the city wouldn't listen to us, I mean, they were like curious and interested, but they could never, they weren't able to like fund innovation with taxpayer dollars,
Yeah.
especially with something controversial like homelessness.
Yeah.
And so we got this downtown real estate group to pay us instead to
Yeah.
cover our costs. So they paid us $100,000 for 2 years to test this out with 500 people each year.
Yeah. People may not realize that Paul Allen was a co-founder of Microsoft, one of the richest people in the world, owner of the Seattle Supersonics for a while. I guess he's dead now,
Mm-hmm, mm-hmm,
yeah. So he had real estate interests there, and they're interested in improving the community because their buildings were in the community
mm-hmm,
where the people were maybe sitting outside of their buildings or in the vestibules of their buildings, and they have an interest in resolving that.
mm. Yeah, yeah. I mean, there was sort of that intrinsic interest that if they could help people sleeping in their doorway find a like a stable place to live and achieve their goals, like it helped
Yeah,
their businesses, helped their
yeah,
real estate values.
yeah, yeah.
So we
And
were
so,
starting, yeah.
yeah, go ahead.
No, I was just saying we were starting to tap into something like there are entities out there that if we can prove outcomes for this user population, it like makes business sense for them. Like
Yeah,
they've got a for-profit tendency, or like they're either saving money or making money or saving time or looking better by us doing our job with this population of folks,
yeah,
in terms of helping them progress towards stability in their life. And we need to figure that out and grow into that.
yeah. And so the business, I know it has evolved since then to a more what looks like from the outside a more sustainable business model. Tell me how you went from this point to arrive at that, and what that looks like.
Mm, mm. Yeah. We were continuing to pilot and demonstrate a lot of impactful data from nonprofits on the ground using our platform to really help people that were not accessing services say yes to services, or people who were accessing services to successfully make it out into stability faster so they could reach the next person in need. So we had a
Mhm.
lot of good testimonies and data coming in, and we were trying to sort of package it up and sell it to the city of Seattle. It was like November of 2019. We lost the city council vote 5-4 to expand from 500 people to 700 people in 2020. And
Mm.
that was, such a hard thing.
Mm.
Um, and it, it kind of, we just were like, okay, I guess we're not going to sell the cities. And we didn't really know what our path was with the county. And then the pandemic hit. And, and in all of that, we sort of said, like, we've got to find a different funder. Again, we ideally aren't getting money from foundations whose priorities can change on a year-to-year basis.
Yeah.
Government has been tough. And so what we learned was that there was actually a stakeholder that was holding the financial bag, the operational bag around homelessness, maybe more directly than even city governments. And that's healthcare.
Hmm.
When you're on the street and, again, you're exposed to the elements, to violence, to abuse, to isolation, to all sorts of things, that this, unfortunately, this world has to offer, it's really bad for your physical health and your mental health. And invariably, it, ends up um, driving you to the emergency room, to the hospital, to the ambulance on a far more frequent basis than the average person.
Yeah.
And so hospitals are typically private organizations, some of them nonprofit, some of them for profit, and they largely can make independent decisions around, innovation. And so we were able to get some interest from them, and also insurers who are like, we see how this is helping generate kind of engagement with social services. If you could help this population start to engage with healthcare services, primary care, behavioral health,
Yeah.
different things to take care of themselves outside of the hospital, they're going to be a
Yeah.
lot less likely to come back to the hospital in the future. And if you can
Hmm.
reduce how many ER visits, how many hospitalizations this population has, that could pay for itself very, very quickly.
Yeah.
So as an entrepreneur, you're hearing that, you're trying to follow the money trail, and then suddenly you're a healthcare company. And we're like, okay, we're a healthcare company. We help this population, achieve better health, avoid costly hospitalizations, ER visits. And if we can do that, that saves these health systems, these health insurers a lot of money. In some cases, actually helps them generate a lot of money. And that's our ticket to sustainability. We
Mm.
won't limit ourselves to healthcare forever, but for us to, it's our beachhead, right? It's our way to grow to some amount of scale before we double back and go after the government again.
Yeah. And how did that take shape? What you're working with insurers, you're working with hospitals. So let's say that well, let me back up for a minute because I just want to be clear about the whole municipal thing. So, the city of Seattle, they were providing some funds, I take it, to have you help a certain number of people with the interest of helping those people be off the street or helping them
It
get into
wasn't City of
housing.
Seattle. We never got any money from them. It was Paul Allen's
Oh,
real
okay.
estate
The
group.
5-4 vote you lost
That
was
was the
for
city.
that was for that
Yes,
purpose. Okay. And
correct.
so when you say you're working with a hospital, uh, the hospital has an interest in not having people come to the emergency room as opposed to more regular care and so forth. But would they
Mm-hmm.
pay you directly for that service, or
Yeah, so
how
like
would
that,
that work?
the economics works like this. If you look at health systems or health insurers' most costly population, the folks that they're losing the most money on, it's almost always people that don't have a stable home.
Yeah.
And let's say the person's healthcare cost on average is $3,000 to $4,000 a month. 48 $50,000 to $60,000 a year, which is, well, way more than I made at the time a year.
Yeah. Yeah.
Um, and so they will say, hey, okay, we'll pay for this. And maybe our fees are like $100 a month or $1,000 a year.
Mm.
That's a small fraction of their current costs.
Yeah.
And if this intervention helps people access healthcare services, social services, and take advantage of what's out there, and a percentage of them, get better or avoid hospitalizations or ER visits in the future, they're paying $1,000 and saving $5,000 or saving
Okay.
$10,000.
So you're becoming, in effect, an outpatient case manager for each of those people,
Um, we're
helping
not
them.
a case manager as much as like a technology or a support that can help people, um, yeah, like take advantage of case management.
Yeah.
We're a tool that case managers would use.
So that they use these services that are available more efficiently.
Yes, yes. So when someone's on the street and they end up in a hospital, they have no ability to pay, the hospital will typically enroll them into Medicaid, which is the
Yeah.
insurance for low income individuals, and they'll get some reimbursement that way. So
Yeah.
they bear a lot of operational burden when it comes to poverty, and some financial burden, because they don't get reimbursed everything,
Yeah.
from the health insurer. But the health insurers, which are companies like United Healthcare, Aetna, Humana, um, and they get contracts from the state government, so state of Washington, state of
Yeah.
Michigan, to insure low income populations.
Yeah.
They make margin when the state's payments, monthly payments for the individuals, which are fixed amounts, let's say
Yeah.
$1,000 per month per person,
Yeah.
when those payments are less than the actual healthcare costs of the population. So
Yeah.
if the person's healthcare costs are $800, they make $200 in margin.
Yeah. Yeah.
If the person's healthcare costs are $8,000,
Yeah.
they're still only get paid. They only get paid
Yeah.
$1,000, so they
Yeah.
lose $7,000 a month on that individual.
Yeah.
And again, like the if you look at the most expensive members that they would be serving, it would be the homeless population.
Yeah.
And so they have a strong incentive to help people find stable housing, and employment and so forth. So their cost, because it actually has a proven effect on driving down costs,
Okay.
from $8,000 a month down to
Yeah.
$2,000 a month, let's
Yeah.
say. And so they were interested in an intervention that could help their members, their costliest members, track towards, housing stability, income
Yeah.
stability, healthcare stability. And
Yeah.
so they took us into their Techstars Accelerator, which is a huge, huge thing for us.
So, I'm curious as to whether this is a situation where these people are already signed up, for Medicaid, and the insurer is getting the $1,000 a month, and they're interested in reducing the cost side of that, or if there are a lot of these people who are unhoused who are not covered, who are not in the system. And so they have the opportunity to get $1,000 a month for 500 more people. Uh,
Mm,
which of those is the more prevalent
it's
situation?
it's typically the former,
Okay.
people that are already enrolled. Sometimes it is the latter, but on the health insurer typically isn't running towards our population.
Yeah.
They have to comply with the state agreement. Like the
Okay.
state is like, we're not going to do business with you unless you insure anyone
Okay.
and everyone that needs help.
Yeah.
And so they agree that,
Yeah.
okay, you can assign us people.
Yeah. So,
And yeah.
so you know what this reminds me of? I'm reminded of Medicare Advantage, right?
Mm-hmm.
Where the insurer gets a certain set amount of money for each life that they're covering there, and their incentive is to have those people use the system as little as possible. So they'll pay for your health club membership
Mm-hmm.
because that's a lower
Mm-hmm.
cost way of keeping you healthy. So it seems like the
Yep.
same kind of idea. It's a lot more complex and a lot more varied what you're doing, but uh,
Yeah.
you're causing those people to use those insurance dollars less.
That's exactly right. And a great example is like paying for someone, making it easier for someone to go to the gym.
Yeah.
is such a effective intervention.
Yeah.
Yes, they want to do the right thing. Yes, they want people to be healthier. They also need to generate margin.
Yeah.
And so yeah, kind of long story short, bringing it to a close, it's like we've been able to demonstrate that impact, or that cost impact, and now partner with hospitals, insurance plans across the country,
Yeah.
um, in a way that's helping us approach sustainability and profitability.
Yeah.
Um, yeah.
Yeah. So, what does the company look like today? I understand you're in multiple cities, and so this model, must be working to some extent. So, what's it look like right now?
Yeah, there's a team of about 15 of us. We've been able to raise some venture capital based on our business model with healthcare,
Mm,
and have been able to sign up some pretty amazing customers that have tens of thousands of lives
mm,
on or near the street, you know, as young as 18 all the way up to 75, that
mm,
need um, that need interventions, that need supports like Samaritan.
mm,
And so it's amazing, like the partners we have, like we can reach, again, tens of thousands, hundreds of thousands of lives, and are in the process of proving the impact over multiple years with these national organizations. So we're serving about 1,000 to 2,000 people a year right now. That's just a drop in the bucket. And as we continue to prove outcomes for the population, which is something I'll work on with your students a little bit this
yeah.
semester, we've got so much room to grow.
Yeah. Well, that's cool. Well, yeah, I have a much better idea now, even than I thought I had an idea before, but I have a better idea now of how it works. Are there other examples in this kind of business model besides healthcare or other aspects of healthcare? Uh, other payer models that are
Mm.
closely aligned that might work for this population.
Yeah, I think, and we're starting to look at adjacent populations now too. I'm really excited about some work we're going to be doing with foster young adults, people that are unfortunately the pipeline for homelessness. If we don't help them achieve their goals in terms of employment, education, housing now,
Mm,
we're looking at reentry. Populations that are returning from incarceration are at significant risk for becoming our homeless population, and getting reincarcerated. Veterans, the outcomes for our veterans are just not acceptable given what they sacrificed for our country.
hmm
And so there's a lot of models, a lot of populations that we're excited to serve, that we see our platform, our support platform, our achievement platform being really effective for. And in terms of like our customers, different customers that have either a financial mandate or an operational mandate, again, saving time, saving money, helping them, helping entities make more money.
Yeah.
I could really get into it over the next hour if I could, um, or even look good to their constituents.
Yeah.
Eventually, like I referenced, like we'll get back to working with government, so cities and counties, and this time, we'll have a lot of proof and a
Mm,
lot more stakeholder buy-in,
yeah.
to justify the usage of
Yeah.
earmarked tax dollars for stuff like this.
Well, you know what? I was even thinking that you left some of those earlier approaches, but I can see where any of those approaches could work. Why couldn't, a million people in Seattle give $5
Mm,
a month? Or,
hmm.
why couldn't every municipality dedicate a certain amount, so yeah, so when you get to a certain scale, maybe some of those things come back into the lens of reality. Two quick questions to wrap up. One is, well, three quick questions. Just in a nutshell, how is the company doing financially?
We're doing good. Yeah, we have healthy customers that are growing with us year over year. We generated like 2 million in revenue last year, so we're also increasing our expenses, like our leadership and our team is growing. And so we're approaching cash flow break even,
Hmm.
which is something, I'm really proud of.
That's great, especially considering the population that you're serving.
We've
So
got so much room to do, so much more work to do, so many tens of thousands of people to reach, and the best way to do it, the fastest way for us to get to people, and Jacksonville, Florida, or Memphis, Tennessee, is by doing things sustainably.
yeah. What is the biggest challenge you had to overcome to, get to this point?
Yeah, I mean, I think it wasn't serving this population. That's one of the easiest and most amazing things to do. I think it's always been like, translating the impact you have on our users to sustainable, durable, scalable customer relationships. Um, and even that, I mean, there's a lot of challenges within that, but I think I'll leave it at that. Is that we've always been so passionate about solving for our users, and it's been a multi-year, almost a decade long process um, to to justify that in a scalable, sustainable way for customers.
So finding and proving in that value proposition for those customers. Would you
Yeah,
say it
yeah, and
that way?
again, if I was to do it again, maybe you start the opposite way, where you're focused on the validating the customer and their potential payment and scale first, and getting pre-orders, and then solving for the population.
Yeah.
But I do think that now, we have cut our teeth with and developed expertise around how to serve this very special population, and even the organizations that are trying to serve the population. So social services,
Yeah.
frontline street medicine, healthcare services, and that expertise is a big piece of how we're growing now on the customer side.
Yeah. Well, just changing the mindset and getting people to focus on the quantitative benefit of what you're doing, that can change the whole mindset in the culture, in the
Mm,
society, right? And could be a huge thing to the extent you're successful at that. So the last question is related, but it's if you could change uh, the narrative about the homeless, or one, prevailing narrative about these unhoused people, what would it be? How would you how would you
mm,
change that narrative? Or what would you
mm.
change about that narrative?
That hmm, that people are too far gone, that people don't change. And I believe that people do, can, and will change if we walk with them, if we get to know their story, if we show enough patience, love, forgiveness, grace, generosity, investment. um may not be everybody, but um most people are just like you and I, and
Hmm.
have skills, have gifts, that tragically they're not able to use because of their current situation,
Yeah.
um, but are no different than you or I besides that.
Well, I've always liked that tagline, walk with, not by.
Mm-hmm.
It says a lot. So, Jonathan, I really appreciate it. Glad we had this opportunity to have this longer discussion. And I really appreciate you also working with my students in the past, and working with this group this semester. And wish you nothing but success, moving forward with Samaritan.
Yeah, thanks. Well, you'll be a part of it, so you're doing more than wishing, David. Thank you for the platform, and look forward to meeting the students.
All right, great, man. Talk to you
Okay.
soon.
Okay, thanks again. Have a great
Bye
evening.
bye. Bye
Bye,
bye.
guys.